yes.
Yes. Okay, great. So yeah, I guess we'll get started on the interview. First, I'd love if you could introduce yourself, introduce your program. Yeah.
Sure, absolutely. So I am Dr. Harold Gomez Acevedo. I go by Dr. Gomez. Much easier that way. I am the program director for the HCA Florida Brandon Hospital Emergency Medicine Program, which is set outside of the greater Tampa area. It's about 25 minutes from the downtown Tampa. I have been the program director for the past right now, it'll be the past 6 months. Prior to that, I have been with the program for the last 3 years, and it's been a phenomenal trip to get here.
That's awesome. Well, thank you for joining us today. I think we should probably maybe start with like one fun icebreaker question. I
Sounds
actually
great.
saw a video about this the other day, and it was what dog breed is like you or your specialty. So I guess if you'd like to choose what dog breed you would be or what your specialty would be.
Sure. I think those are two different ones. I personally think it will be a Saint Bernard, uh,
Okay.
kind of more like quiet, not very uh, energetic. But in the inside, a lot of energy. A lot of stamina more than energy. Uh, and I don't like the cold, but I still enjoy being outdoors, which is kind of what that breed likes too. So, in terms of the specialty, it's more a difficult one. There's so many different personalities in the field. Uh, I think emergency medicine will be more like a Labrador. It's very a lot of energy, but at the
Yeah.
same time can be very restrained and very thoughtful, smart, outdoorsy in a way. Yeah.
Yeah. Yeah. That's interesting that you chose that dog because I've seen it as like Australian Shepherd, Labrador, Golden Retriever. Kind of those, yeah, they're energetic, but they can like remain calm and composed when they need to
Yeah.
be, good at socializing. But yeah, but also like just good in action. So that's a good that's a good answer.
I mean, it
Um,
goes with the field, I would say. I'm not surprised other people have chosen the same one.
yeah, absolutely. For I guess more about your program, what does a typical successful resident look like at your program?
So I would say I see many different kind of residents succeed here. I would say what I find in common is that they all are hard workers. They all are very much interested in improving themselves all the time, looking for opportunities to learn, and at the same time they're very invested in improving their communication skills. I think we only emphasize a lot of the technical aspects of the training, uh, but someone who knows how to communicate or that is willing to improve that soft skill has always been able to succeed in our program. I'm gonna go out on a limb and say that's probably the same for a lot of other places, but it's
Mhm.
definitely be true for my residents.
Okay. And for some more clarity about your program, is it 3 years, 4 years? Is
Sure.
it very academic, rural? What is the setting?
Sure. So we are a community program. Mostly we serve a middle class community here in kind of middle class population. Um, it's more suburban in nature. We are kind of right in the middle of the more rural space in the city of Tampa. So we see from both sides. We are a 3-year program. We do have a little of an academic flavor to our program because a lot of our faculty are subspecialized. So a lot of them have pursue fellowship training, and so that brings a lot of that academic environment to our place. Um, we have been open for the last 6 years, so since 2018, and so far we have been very successful with our residents, and we continue to grow our program. And we take
That's awesome.
12 residents per year right now, and yeah.
Okay. And you think in the next year or two that number is going to stay the same?
So we have seen an increase in our the number of patients that we see right now.
Okay.
with COVID, that number went down. So it is possible that we're going to increase that number in the next couple of years. It all depends on how, things evolve. We
Right.
want to make sure that our residents get appropriate training. So a lot of that relies on how many patients we're seeing, how many procedures they have available. Right now, that is a very robust experience in that sense. But I don't want to change that unless, there's a need.
Yeah, absolutely. And I know it would be a little difficult to go into the exact detail of the curriculum from, month to month, but if you could give kind of a broad layout of what your curriculum looks like across all the years, that would
Sure,
be great.
absolutely. So in the first year is a lot about setting the foundational knowledge for emergency medicine. So interns spend a lot of time in the emergency department, but they also go out to do a lot of other offsite rotations. So they go to do neurology, orthopedic surgery, and that is outpatients, a more procedural heavy rotation. They go to medical ICU. Um, During that time, they also pursue 1 month of ultrasound. And those are the big rotations for the first year. Second year, it's more of learning to become more efficient and kind of really solidifying that already set foundation. So they still spend a lot of time in the emergency department, but during that time, they also go to do other rotations outside, including trauma. They also do a emergency medicine rotation at a different site to give a different kind of perspective of what it's like to practice at a different site. And during senior year, that's when they uh, they practice outside in a pediatric ICU. They do a trauma rotation, and then again they go for medical ICU once more. There's a few electives that we offer during that time: ultrasound, research, quality improvement. I would say our program is very heavy on ultrasound experience and also in the medical education and simulation environment. So that is kind of interspersed throughout the whole 3 years. And additionally, we have a longitudinal experience for pediatrics, which is a frequently asked question. So every month in the emergency department, there are pediatric shifts that are assigned during that time, in addition to another one block of pediatrics during senior year.
Okay, awesome. I think that's a great. It kind of shows how the field is adapting to use ultrasound so much because it's such a quick diagnostic tool. So it's great that you guys have that experience. No need to, call in someone or go down to the ultrasound that's going to take forever. Like you guys are there diagnosing it and able to come up with a treatment plan immediately. So that's great that you get plenty of that experience. And I guess your residents, if they decide to pursue a fellowship in that, they already have so much training in
Mhm.
that field. So
I am
that's
very
really good.
biased. I did a ultrasound fellowship, so evidently I love to talk about ultrasound and the use of ultrasound in emergency medicine. I think at this point, it's pretty well established. The use of ultrasound is very beneficial for our patient care, and helps with diagnosis, optimization of flow. I think, in the wise words of someone who taught me before, ultrasound makes a good clinician into an excellent clinician. So it's a skill that is definitely very much standard right now. And we try to integrate that through the whole 3 years. So our residents are very good at, excellent at ultrasound at the end.
Great. And like you said, since there's so many different rotations, I'm sure the schedule varies per like each rotation, but what is a typical schedule like in a week for a resident, if you could
Sure.
summarize that?
One of the good things about being a newer program in a way is that we are very flexible in the way that we integrate our schedule. So meaning we definitely take a resident requests into account when we build our schedule. During a typical ER rotation, there is typically 1 week of night shifts, and we try to accommodate that to make sure that we do it at the best time for the residents. And then the rest of the time, it's a variety of morning and afternoon shifts. All shifts are 10-hour longs. We don't have 12-hour shifts except for one rotation, and that is when our residents go to the ICU or we do have an experience in the freestanding for 1 month, freestanding emergency medicine, which is kind of become more common right now in the field. So we want to provide that opportunity for the residents to experience what it's like to be there. Uh, in different rotations, is the schedule varies a lot. It all depends on what the rotation is during labor and delivery. Um, there's a combination of days and nights. Same for ICU and trauma. The other part is as residents transition from intern to junior to senior, there's a reduction of shift that happens just to provide more opportunities for other ways to engage with the residency.
Great. And I know that you said again, there's ICU experience, there's ortho procedure experience. Would you say that the ER residents get to do a lot of procedures, or is it passed off to maybe other specialties, or what does that look like?
So one of the big advantages of our program is we are unopposed residency. So our residents get the opportunity to do almost all, if not all the procedures that come into emergency department, from fracture reductions to intubations, chest tubes, you name it, they get to do it all. Everything with the supervision of the attendings. When they are in a different rotation, that makes them a kind of the go-to because of the experience they already had. So a lot of the other residents will go to them to request help how to do procedures. So it is all our residents doing that.
And typically, is there an average number of patients that a resident would be managing, and does that differ based on the years?
Mm-hmm. Yes, it does change based on the year. We actually have some kind of some rules that we set for our faculty to know, what are the expectations, and for the residents to know, this is where I need to work to get to this level. An intern will be expected to be at about 1 patient per hour by the end of the year, actively managing 2 to 3 patients at a time. Eventually, that will change. Some people will have different goals. If you want to be someone who wants to get more exposure, there's no limits to that. We just want to make sure that you are getting the appropriate educational experience. So we are very heavy on education over service in our program. A second year resident should be seeing about 2 patients per hour by the end of the year. And a senior should be seeing definitely 2 patients per hour. And at the same time, should have the ability to learn how to manage the rest of the emergency department at the same time. So supervise a little bit of the other, or at least have knowledge of the other patients that the other residents are seeing.
Okay, great. And what does the team typically look like? Is there, I guess, PAs, NPs, advanced practice practitioners, or is it like a resident, a senior, and attending?
Typically, it is a one-to-one. So our ER is divided into what we call pods, and these are just teams that work together. And most of the time is comprised by an attending physician, one resident, and sometimes there's a second resident, but most of the time it's a one-to-one. There are APPs or advanced practice providers who work in our emergency department. They kind of float around and see different patients in the different pods. They are typically the lower acuity patients, so we have some pretty clear rules of what our expectations are for what they can see, and they're actually very supportive of our residents. And if there's something interesting that they have, they typically get the resident involved right away. And we have found that having that one-to-one is our best setup to have a more profound educational experience, because there is a lot of teaching moments during that time, and the residents have direct access to the attending, so there's not that typical hierarchy of going to the senior and the senior presented to the attending.
Mm-hmm. That's very interesting. How do you promote wellness at your program?
So we have had a change on how we approach wellness. In the past, we were relying a lot more on the event kind of approach to wellness, which I think was pretty standard when we were trying to change or change our field. And it used to be, we'll have social events, residents will go and try to socialize during that time. My philosophy is more job hindrance reduction. We still have social events. We actually have a amazing kayak event what we do every year. We go to one of the estuaries here in the area, and we all go out and we watch manatees and dolphins and out there, which is great. We have a beach day where we all go to the beach and spend the time together. But at the same time, I emphasize a lot of making sure that I can reduce the number of hindrances that there are in your job as a resident to be an efficient physician. So I do a lot of rounds in the emergency department, making sure that I look for things like, is there a computer that doesn't work? Is there a printer that you need fixed? Is your microphone doesn't work? Do you need to have more food in the resident lounge? Do you need a new chair? So there's a lot of that work every day to make sure that when you come to work, you feel you can see your patients and you're not really annoyed by those little things, which I personally find improve my wellness too, if I didn't have to
Yes.
deal with those. So I think that has been very successful because it's, you come to work, you don't have to get annoyed by those little things. The other thing is we really try to do a lot of team building, and we really, look out for each other. But we hold what is called a what went well every time we meet with the residents, so we can share, stories of where our residents have made an impact in someone's life. What has been, an interesting case that our residents have seen. When have you had a colleague who has helped you, I don't know, take your dog out because you were working and didn't have anyone to do that? So it's like a shout out match, and it's actually a very positive experience. I think it's definitely helped orient our environment in that direction of more positivity.
Yeah, that's great. I definitely think that having events is nice to, get everyone close together and have that community, but you don't realize how much the little things impact your work performance and satisfaction. Like, yeah, I need my dictation device. Like, if
Yeah,
I don't have that, maybe my charting gets slower and things like that. So it's really great that you try and make sure those things all run smoothly.
and it's
Um,
little things sometimes, but sometimes larger items like what residents were requesting to have more access to food, which I completely understand. When I'm working, I
yes.
want to have food that is available to me, right? And don't have to go
Yes.
to the other side of the hospital, and I have to leave the ER. So we give them a food stipend. They can use it in the cafeteria, but at the same time, they have food available in the resident lounge, which is in the ER. Um, it, and nothing against events. I love going to those events. I love to socialize, but at the same time, I understand if you have a family, you don't want to be forced to go to an event. So we make
Right.
it that so it's not mandatory. A lot of people still show up, but if you want to spend time with your family, you should be able to do that. It is what wellness is different for everyone. So we definitely take that more personalized approach.
Yeah, that's great. Do you participate in VSLO, or how could students sign up for elective rotations if they're interested in your program?
So we use a different application service. It is called Clinician Nexus.
Okay.
And yes, and the reason why we use that is because it's free. We don't like the fact that you have to pay for the other one. So we make it so it's
Mhm.
not a burden for the medical students to apply to rotate with us.
Okay, great. That's awesome. How could applicants stand out, or what do you look for while students are on these elective rotations, auditions?
So I would say in when you're doing your audition, I think the thing that makes any applicant stand out is to see they're enthusiastic to see patients and to practice emergency medicine, right? So if you're rotating, you should be kind of proactive. Go out there, seek out the opportunity to see patients and to start practicing what it's like to be a resident. So looking for opportunities to present to your attending, opportunities to perform minor procedures with supervision, but we definitely encourage um, that request to do them. Additionally, get to know the people on your team, ask questions, what it's like to be a resident here, how do you um, get along with your friends here in the area, do you have so it's just more of a communicating with the team. You don't have to be necessarily the most extroverted person in the room, but at the same time engage with the people there to kind of get to know the program. It shows that you're interested. It shows that
Mhm.
you want to integrate in the social environment, which is we find it's very important when you're going to residency to have that network, and the best way to do that is by be someone who integrates into a team.
Absolutely. What would you say residents say is the best thing about your program?
Um, Good question. That's a good question for a resident. Uh,
Okay. Yeah,
but
you,
I
I
would
guess you
say,
haven't really been living the resident life. So,
uh, but the times that I've asked about this, the answer is kind of consistently the same. Is the people that I work with, that they work with. So it's the other residents in the team and the faculty that are there, just because they're all very committed to the growth of the program and the development of the residents. But at the same time, they're very approachable, very open. It's a very collegial environment. I would say that's the number one thing my residents appreciate about the program.
great. Thank you. Yeah, I know it's kind of hard to speak on that if you're not a resident,
Yeah.
but I think that's definitely great that you guys have a good community and everyone feels supported. What is one message you would want applicants to take away from your program?
Um, I would say is that embrace and showcase the experience you've had in the past. They will make you a stronger clinician, a stronger emergency physician. And that's kind of one of the things that we look for is we want to see people who you may have struggled in your past, but you overcame those challenges. So don't be afraid to bring those challenges up when you're, talking to program directors or faculty or residents at a program. Use those more as a way to show that you know how to grow or do you have learned through those experiences.
Absolutely, that's great. Well, I think that's all the questions that I have from my end. I'm not sure if there's anything else maybe you'd like to address. We could address that, but
No,
it's
I
been
mean,
so
this is
great
great.
talking with you.
It's been great
Yeah.
too. I appreciate the time.